Have you ever felt knee pain in the morning, stiffness, or difficulty moving after sitting for a long time? This could be a sign of knee osteoarthritis, a very common condition affecting millions of people worldwide. According to the Arthritis Foundation, arthritis doesn't just happen to the elderly, it also affects young people, especially those with unhealthy lifestyles. So, what makes arthritis worse? One of the most important factors is diet. There are foods you might be eating every day without knowing they are silently increasing your joint inflammation and worsening the damage. In this video, let's explore 9 foods to avoid when suffering from knee pain. Make sure to take notes and watch until the end to avoid these food groups. The first group is sugar. A study published in the Journal of Nutrition and Metabolism in 2018 indicated that sugar increases inflammation in the body by producing cytokines. This is a group of proteins that promote the inflammatory process. Consequently, this leads to increased inflammation levels and makes your knee condition more severe. Sugar can cause obesity, and the excess energy reserves generated by sugar will increase your body mass, putting increased pressure on your knee joints. Therefore, you should avoid eating too many sweets, pastries, and sweet fruits. Second is fried foods containing trans fats. Trans fats found in fried foods will increase the inflammatory activity index known as C-reactive protein, or CRP. This is a biomarker of the inflammatory response. When CRP levels in the joints rise, it increases arthritis inflammation and slows down the recovery and regeneration process of your cartilage, weakening cartilage tissue and reducing joint mobility. Therefore, in specialized treatment processes, the initial goal is to reduce inflammatory reactions. So, in the early stages of treatment, we often combine various anti-inflammatory groups such as omega-3, glucosamine sulfate, or piasclidine. These types cause few side effects, are very safe and benign, and reduce inflammation gradually. Subsequently, this will safely and effectively lower the CRP index within the body. Third is red meat and processed meat. Red meat contains arachidonic acid, a type of fatty acid that can trigger inflammatory reactions. This is according to a study published in the journal Arthritis in 2021. It increases chronic inflammation, weakens the immune system, affects cartilage regeneration capabilities, and aggravates your knee pain. Therefore, you need to limit fast foods like sausages, bacon, beef, and lamb. Fourth is the group of dairy products. Milk contains casein, which can stimulate inflammatory reactions in some people. It can cause pain and stiffness in those who are lactose intolerant and increase inflammatory responses in rheumatoid arthritis. You should avoid cow's milk, cheese, and ice cream. Group number 6 is fast food and processed foods. Processed foods contain preservatives and hydrogenated oils. They can exacerbate the state of inflammation. Seventh is coffee and caffeinated beverages. According to a study from Johns Hopkins Medicine, caffeine reduces calcium absorption, affecting the joints. Therefore, you should also limit coffee, energy drinks, and strong teas. Eighth is alcohol and beer. Alcohol increases the production of cytokines, which cause inflammation and worsen arthritis conditions. This is a study reported by the U.S. National Institutes of Health, NIH, in 2020. Ninth is foods containing a lot of gluten. Gluten found in wheat and barley can be harmful to people with arthritis by stimulating inflammatory reactions and worsening symptoms of joint pain and swelling due to autoimmune mechanisms or sensitivity. These are foods with a high potential to cause severe joint inflammation in the body and trigger serious bone and joint pain. So, food is very important, and lifestyle habits are equally important. So, what should people with joint pain eat? Here are 8 foods for people with bone and joint pain that you definitely shouldn't miss. First is salmon or fish rich in omega-3 fatty acids, which will enhance blood circulation and effectively limit and reduce conditions of inflammation and joint pain. Second is green tea. This is a food type containing strong antioxidants like flavonoids, thereby reducing bouts of inflammation and bone and joint pain. Third is bananas. Bananas provide many components such as potassium and magnesium and increase the body's ability to absorb calcium. Fifth is soy. Soy products are good for people suffering from bone and joint pain. Protein in soy increases bone density and reduces the process of osteoporosis in postmenopausal women. Sixth is broccoli. The main component of broccoli is sulforaphane, which has the task of neutralizing enzymes that cause joint pain. Seventh is turmeric. Turmeric contains a lot of curcumin, a strong antioxidant that inhibits inflammatory reactions related to bones and joints. If you like this video, please help spread the word by sharing it. Bye for now and see you next time.